Locum tenens doctors make how much? Dr. Greg here, and I've got some juicy news for you about locum tenens and how much you as a physician or a nurse practitioner could make. Before you listen to the rest of this, do me a favor, hit that like button on this video because I'm trying to reach more doctors to encourage the freelancing lifestyle because truthfully, I think so many of you all would be happier if you could switch jobs, if you could move where you want to move, work with who you want to work with without all the obligations. It'll help you fight physician burnout and keep you happy. But I want to tell you about some juicy stuff I got about locum tenens. And, you'll be surprised to know how much money doctors can make in locums. And I'm going to kind of break it down by specialty for you because I think you're going to find this stuff interesting. And I got this information from a cool website called Locum Story. And Locum Story, it's actually owned by one of the locum tenens companies, but it doesn't push you into anything and it just kind of shares information. So I like them. I find them great resource for physicians or nurse practitioners or looking to do locum stuff. So here's the latest gossip. Here's the juiciest stuff. This is straight from their site. And this is how much money you could make by specialty if you became a locum tenens physician. So let's start out with a good one, radiology. They can make $275 to $350 an hour. Pretty good. Now, there isn't a super high demand for radiology, so compared to the other things I'm going to list, the demand's a little lower, but if you get the gig, it pays pretty well. Everything else, there's a huge demand for. Urgent care. You can make $120 to $150 an hour. Huge demand for that. You could work anywhere. Peds, $80 to $105 an hour. How about OBGYN? Now, you may be surprised to know this, but that's actually a pretty good field to do locum. Now, you may think, oh, you have to have this long-term care and you've got this clinic and you can't travel around. And that isn't the truth at all. OBGYNs, locum is great for because there's a lot of places you could set up your practice and just do surgery or just do clinic and see clinic patients or urgent visits. There's a lot of opportunities. They make $150 to $200 an hour. Now, again, this stuff is sort of national averages. It certainly varies by location. So in a particular place you're looking, it may be much higher or much lower. All right. How about nurse practitioners? So if you're a nurse practitioner here, they say you could make $54 to $110 an hour doing locum tenens. Not bad. Lots of demand, lots of job options for nurse practitioners. Now, if you're a nurse, an RN watching this video, there are certainly tons of ways that you could do travel nursing as well. I'll have a later video about that. Excellent option. I always recommend RNs consider travel nursing. All right, back to my physician friends. Internal medicine. Again, you may not think of internal medicine as one of those things you could travel around the country for. It turns out internal medicine is also a great locum tenens option. You can go and you can do urgent care. You can go fill in for people in their panels. There's all kinds of things. You could work in hospitals and places that allow that. Lots of options. I mean, with internal medicine, you can really go anywhere you want. And they make, drum roll please, $100 to $140 an hour. Again, if you like this video, please hit that like button. If you want to leave a comment, do me a favor, leave a comment. I'm trying to help out more physicians like you with physician burnout. Spread the word. All right. How about general surgery? General surgery is a good one. I love general surgeons. I work with them all the time. Another great option for locums if you are maybe burned out of your toxic coworker practice or you want to see what it's like doing surgery somewhere else. General surgeons can make $165 to $220 an hour. Anesthesiologists. I know firsthand. I'm an anesthesiologist. Done lots of locum work. The rates for us have gone up. They didn't used to be this high, but the rates for anesthesiologists are now up to $275 to $350 an hour. Not bad. Again, heavily depends on where you're working. And then finally, my friends in emergency medicine. How you all think you're doing on this category here? Emergency medicine, big demand, perfect for locum tenens. You could go anywhere you want. You want to try doing something like in the outback of Alaska or maybe in a more urban place like Chicago. Lots of options. Emergency medicine doctors, $175 to $300 an hour. So there you have it. Lots of money to be made doing locum tenens. Huge demand, except maybe radiology, but even that there's need for. Any specialty pretty much will work. You'd be surprised. And go out there, have some fun. If you have questions, Dr. Greg Charlotte here, and I'm happy to answer them. Go look me up. And my book, The Physician Wellness Project, which is available on Amazon, Audible, Barnes & Noble. Grab your copy of The Physician Wellness Project, and you'll learn all about freelancing for a physician.